Product Management, Marketing, and Business Development at QMedic. Please join me in welcoming Sombit Mishra.
I thought today, in the spirit of talking about pain points in healthcare, I would kind of tell you a little bit about our philosophy at QMedic, as well as, can you guys see, oh, you can see that. Yeah, I thought I'd share our philosophy at QMedic about what we see as the pain points in healthcare, as well as kind of our approach to mobile health and where we see both opportunities and barriers for mHealth innovators. And before I do that, I just want to get kind of a pulse of the audience. So who here in the audience represents an innovator, or somebody who's interested in kind of getting into the startup world? And then payers? Any payers? No, there's never a payer in the audience. So, pain point right there. Yeah. Any physicians, providers? And I think that all of these markets kind of fall differently into these in this spectrum. So quantified self, the great thing I think about quantified self, if you are targeting that market as an innovator, is that the payer is the provider, is the patient, which is fantastic from I'm selling one customer on this solution. So, I've talked to people who are like, I want to quantify my calories, my steps, my heart rate, some disgusting things that they really want to quantify, but I don't have to get into here. It really is kind of disturbing. Brain activity, obviously, as you saw from the guy in the picture, but I think that and you can charge a premium. Some people will say, wealthy individuals may pay $100,000 for your particular user experience, but the reality is that market is very small, and it's not going to move the needle. Unless payers get into that game, I don't believe it's going to move the needle on reducing healthcare spend in this country, where there's a big pain. Is that if you think about user experience, even companies like Rovio that develop Angry Birds, they have a shelf life. It's like, if you talk about gamification, it has a shelf life. You have to develop a new application every few months. And if you think about the challenge in healthcare, that's something that's just a game. If you think about the challenge in healthcare, it's like, well, how the hell are you going to create something that's so fun that people, changes people's behavior and gets them active? It's I don't want to say it's a pipe dream, but it's really hard to sell on that proposition. So I think, I don't know the full answer to that question, but our experience in gamification and kind of user experience was very difficult versus the data collection, which is where our experience is more. It's our expertise is more in that area. We thought we'd focus on that.
So who is your customer? Is the payer or the caregiver?
So, in kind of attacking the personal emergency response medical alert market, what we liked about it is that it's kind of attacking something that's lowest common denominator, where there's a health proposition long-term of telemedicine, being able to contextualize interventions.
Then he will tell my mom what she should give me. She'll tell me, Mohan, okay, don't worry, you'll be all right. We can play ball in the next couple of days. Make me calm and happy. Then you tell my mom and dad what to do, all the medicine, everything else. And his fee will be a nice home-cooked meal. So he is taken care of by the entire community. And everybody knows everybody. It's a synergistic environment. And the healthcare is so personal. That is one extreme example of what healthcare experience is. Am I satisfied? Of course I'm satisfied. Doctor only gave me the medicine, I did the right system. Little things, and they're all sweet. Wonderful.
When you talk about collection of data, the major challenge in the industry is whether you do it in a big data. The three things: privacy, security, and access consent. Right? Access consent based on the role. If I'm the dean of the hospital, if the patient is not my primary patient, even I cannot see my wife's or children's data. So that kind of access and role-based consent, and also privacy. There are international laws, federal law, tribal laws, and state laws. So you have to deal with, where you collect the data, who owns the data, because you get security breaches, privacy breaches, HIPAA and other things. How do you deal with it?
HIPAA and privacy issues is pervasive in anything you touch or talk about healthcare. question will also, that will be probably number one. And that will be the right away. I'll give you an example. Suppose I'm in the hospital and I want to have a mobile device, which is one of the things we are planning on and other people doing that similarly. And they want to know if, I want to know if there is food is hot. We do not want to collect the patient's information. All I want to know is the bed number.
It acts as a, it increases costs on an exponential level relative to the actual direct cost of care providing those services for covering mental health, treating mental illness. So we created a system that tracks a patient's outcomes as they progress through the treatment process. And what happens is the patient is very quickly onboarded when they come into the doctor's office. They start receiving text messages that are standard based on the diagnosis that they're set up for, and then they can be customized throughout time. So the advent of the modern smartphone kind of started with the Mohan. That was the first more widely accepted, used, purchased smartphone as we currently see them. BlackBerry was the first computer a lot of people adopted, and that was because of the influence that the enterprise had on paying for those, having the employees use them, and it was a secure way of having email anywhere you were. So, and of course, as everyone knows, the Apple iPhone came along, and that, you know, the first couple iterations, people loved it because it was sexier than the other ones, but it still didn't really take, you know, merge into its dominant role until the iPhone 3G, which provided internet access anywhere in time. So there are currently 27,000 unique healthcare related applications in the medical and fitness category, either on the App Store or on the Play Store. And 20% of all smartphones actually have an app installed at this point. So people are interested in using the mobile phones for health, either for information or for fitness, but people are really looking to use their phones to get health data.